right, Mata?
Yes.
Hi, come on up.
Hello.
How are you doing today?
I'm doing good. How are you?
I'm good. So our receptionist is out. She had an emergency. I'm the doctor, and I'm going to be just doing your intake form here. Is that okay?
Yes.
And then we'll head into the office, okay? So I have your name down. Can you confirm your date of birth?
6/14/1992.
Awesome. And so you're here for just an abdominal examination.
Yes.
Can you tell me a little bit more about the pain you've been having?
Sure. So I started about like a month ago.
Okay.
Where every time I would do activities like walking or lifting things, it would really hurt in the abdominal area.
Okay.
Sometimes even after I eat and have food, I feel a little bit of like heaviness in that area.
Okay.
And for the past, I would say like 4 days, it's been a little bit worse than before.
Okay.
And that's why I wanted to have it checked.
So when you say like heaviness, would you describe it as nausea?
It's like a sharp pain.
More like a cramp?
Yeah.
Okay, like a sharp pain. So right now on a scale of 1 to 10, how would you rate it?
So now about like 6.
Okay.
But when I wake up, usually it's about like 8. So.
Okay. All right. I'm going to ask you some questions like kind of that might seem unrelated about other parts of the body. I just want to make sure there's nothing going on that might be like a comorbid issue, okay? So just with your head and neck, any hearing problems?
No, not really.
Okay. Throat pain, hoarseness, swallowing?
Swelling, yes.
Okay. Swelling of the throat?
Yeah, and feeling a little bit dehydrated even though I drink a lot of water.
Okay. Dehydration.
Yeah.
Definitely be looking in your mouth to see if there are any signs of glossitis or dehydration. What about your chest? Any shortness of breath?
Yes, actually, especially when I lay down.
Okay. All right. Coughing, wheezing?
Coughing, yes.
Okay.
Which is usually at the same time as the shortness of breath.
Okay.
I feel like.
Okay. Sure. All right. Chest tightness, pressure with exertion?
Just a little bit of pressure, I would say.
Okay.
Yeah.
Okay. Heart racing or skipping beats?
No.
No. Okay. Good. All right. And how are your bowels? Any constipation, diarrhea?
I have been experiencing diarrhea actually.
Okay.
It gets worse if I don't eat, let's say, homemade meals, but it's something that I didn't experience before.
Yeah.
So it was a little alarming.
So an onset of sensitivity in your stomach to certain foods. Okay. And how long has that been going on?
Like maybe 2 weeks or so. Yeah.
Okay. Painful or frequent urination?
I would say frequent urination.
Frequent, okay.
Yeah.
Okay, but no burning sensation when urinating?
No.
Okay. Frequent UTIs?
I did get a UTI about like 2 months ago.
Okay.
I took antibiotics for it.
Okay.
And then got tested again and it was
And
gone.
that cleared up? That's good, okay. And then not a lot of UTIs since, before and after?
No.
Okay. It's common to get them every once in a while, but if you have a lot of them at once, that would be a concern. Okay. What about your skin? Any dryness or itchiness in the skin?
Just my hands.
Okay.
And also like around my knees.
Sure. Okay.
So like back of my knees.
Okay.
Yeah.
Any change in moles or skin tags that have changed in color or shape?
No.
Okay. Okay. Poor memory, concentration?
I would say, yeah, I kind of have a hard time like focusing on things.
Okay.
I just tend to get a little distracted
Okay.
from time to time.
Sure. Do you take any over-the-counter medications?
Just painkillers if I have
Painkillers.
like Advil, ibuprofen.
Sure.
Yeah.
Is that on a daily basis? Or?
Just if I have like pain, or
Okay.
if I have, I don't know, like my knee pain, or if I have like the abdominal pain.
Sure.
I just take 1 or 2.
Okay.
Just to help me sleep.
So every once in a while.
Yeah.
Any prescription medications?
No.
Okay. Okay. Just gonna ask a few more questions that might have to do with the stomach area. Cramping, heavy PMS symptoms, bloating, cramping.
My cramping has gotten worse.
Okay.
If I'm on my period, for
Sure.
example. And again, I just take over-the-counter medication for it.
Okay. And that usually helps?
It usually helps, but I need to take like 3 or 4 for
Okay.
it to help.
Okay.
So
That can be any emotional problems lately besides the stress of life, any persistent emotional irregularities?
yeah, I think it
Okay.
comes from lack of sleep too.
Oh,
Just
okay.
problem sleeping, and I think it kind of just affects my mood.
Sure, sure.
So
Irritation?
yeah.
Okay.
Yeah.
Okay. Any major transitions in your life right now that might cause stress? Moving, changing of relationships, a job change?
A job change, I would say.
Okay, right. Is it a positive thing?
I'm kind of like looking, so
Okay.
it can cause a little bit of
Yeah,
stress from
I'm
time
sure.
to time.
Absolutely.
Yeah.
I totally understand that.
Yeah.
Okay. And so I do think you sent over your risk factors with your family history. Okay. So if you don't have any other questions for me, I'm going to bring you into the office and have you sit down. I'm just going to look at a few vital signs. Then we'll have you lay on the bed so I can look at your stomach.
Okay, thank you.
All right, on top. So just going to pop on some gloves here. Just do a few preliminary tests with you in the seating position. Okay, go ahead and just extend your hands for me straight. Okay, beautiful. No shaking. Just gonna look here for any scars or discoloration. Okay, and then I see here the nail beds look very healthy. Go ahead and extend your palms like this. Oh, that's beautiful. No signs of liver flap. Okay, rest your hands for one moment, please. Okay. Let me go ahead and see your palms. Okay. Okay. Veins look healthy. Not seeing any problems here. We're going to check for clubbing of the fingers. I want you to take 2 fingers and push them together like this. Oh, that beautiful gap means your liver is healthy. Okay. Now extend your hands. Okay. Just going to take your pulse. Make sure your legs are uncrossed. Okay. Very good. I'm just going to grab them right here as well. Okay, excellent. You can rest your hands down. Okay. Okay, and if you could pull your eyelids up for me. Okay. Good. No signs of anemia. Now pull them down. Looking for signs of jaundice. No signs of jaundice. Your pupils look very healthy and white. Very good. Okay. Go ahead and face me slightly. Okay. Go ahead and stick out your tongue for me. Okay, no signs of glossitis. I am seeing a little bit of dryness in the mouth, which is what you were referring to with the dehydration. So I'm just going to make note of that here. Okay. So I'm going to palpate your face and shoulders right now, okay? You can just relax. Close your eyes. Just feeling along the jawline. Okay. Preauricular lymph nodes are non-palpable. So are your post-auriculars. Slightly tilt your head this way. Good. No palpability here. Okay, go ahead and open and close your mouth for me. I'm just feeling for any clicking or popping. Okay. Go ahead and raise your eyebrows for me. Raise them all the way. Go ahead and lower them. Okay, very good. Try to shrug your shoulders for me.
Oh, like that?
Yeah, okay, good. Perfect. All right. Just going to be palpating your shoulders, okay? So, along with the cramping that comes before your period, do you experience muscle aches throughout the body or just in the usual areas?
Just the usual.
Okay. Okay. Okay, I'm just going to examine. No abnormal curvatures in the spine. Go ahead and look up at the ceiling for me. Just going to palpate your thyroid. Okay, very good, non-palpable. Here. I'm gonna check the other side. Okay. I'm not seeing any signs of severe hydration in the skin, which is good. I do think that you're having some dryness, but I'm not seeing any signs of prolonged dehydration, no chafing of the skin, cracking, things like that. Your skin looks very moist and healthy, actually. So, okay, I'm just going to be palpating here. Okay. Extend your hand for me, Jen. Thank you. everything looks good so far. I think we're ready to have you sit on the bed or lay down on the bed, and we'll begin that exam. Okay. Okay, Top, are you comfortable?
Yes.
Okay. If you don't mind just putting your hands to your side, I'm just going to lift your shirt slightly and lower your pants, just so I can see the belly. Okay. Perfect. Is that comfortable for you?
Yes.
Okay, very good. So I see you have a belly button ring. Has it been giving you any problems? It looks very healthy. The piercing looks non-irritated.
Yeah, it's been like a long time. So now it's finally good.
Okay, some issues in the past, but it's good now. Okay. I'm gonna start by just listening to the stomach, okay? Just relax. Okay. Okay. Hearing some slight acidic buildup. Do you drink coffee?
Barely.
Like what, sometimes?
Sometimes,
okay.
yeah.
Oops. Just going to do some percussions of the stomach now. Just continue to relax. Okay. Okay. And I'm just going to take the temperature of your stomach in a few different locations. Okay. And I just want to see if I can just sanitize the area and make a sample of the belly button just to rule out any signs of cellulitis. Would you mind taking out your piercing so I can do that? Okay. Okay, you can go ahead and give it to me. You can sanitize that before we put it back in. Just gonna set it to the side here. Okay. So, just gonna prep the area with an alcohol pad. To take a quick sample. Okay. Sorry if this tickles a little bit. This aside. All right. Don't see anything visibly concerning, so that's good. Just going to take a look inside the belly button just to make sure that there's no skin infections. Okay. I don't see any abnormal buildup. No signs of scarring. No redness. Looks like the piercing is agreeing with your skin. I'm not seeing anything to be worried about here, but it's good that we took this sample. Just gonna look with another light. Okay. I'll set this aside. Okay. So it's just giving me a better idea. Okay. Seeing some minor flaking actually here. I don't think that's where your issues are stemming from, but I might want to apply some treatment for that. Would that be okay with you?
Yeah, sure.
Okay. Great. Before I do that, I'm just going to palpate the stomach now with my fingers, pressing gently just to feel the organs underneath your abdomen. It shouldn't be painful, so if you feel any kind of pain, please let me know.
Sure.
Okay. Your organs feel very healthy. No enlargement. Nothing hardened. Just gonna feel the lymph nodes right here by the pelvis. Non-palpable. Just gonna go right here. Okay, I'm really happy with that. Okay. Do a couple of sensory tests just to gauge your any kind of numbness that you might be having. So we're going to start with a pressure point test. Okay? So this will be 1 pressure point.
Okay.
This will be 2. Okay. Can you feel the difference?
Yes.
Tell me 1 or 2. Okay.
1, 1, 2, 2, 1, 1, 2, 2, 2, 1.
Good.
2.
Good.
1, 2, 1, 1, 2, 2, 1, 2, 2.
Good.
2.
Good. Okay. And the second and last test we'll do is a sharp or soft test. Okay. This is a soft sensation. This is sharp.
Okay.
Go ahead and say sharp and soft, depending on which one you feel.
Soft.
Good.
Sharp. Sharp. Soft. 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 Sharp. Soft. Sharp. Soft. Sharp. Sharp. Soft. Soft. Sharp. Soft. Sharp. Sharp. Soft. Soft.
Good. Excellent. Okay. Got a couple of those wrong, but most of them right. Okay. And before I apply the treatment that's moisturizing and cleansing at the same time, I'm just going to take a few measurements of the stomach area just to judge for symmetry and to make sure that everything's good there. Okay, so go ahead, you can close your eyes. Okay. Right. And ears. Okay. Good, I'm seeing really good symmetry. No signs of edema. Okay. Okay. Another. Going to measure just this indentation here on the belly button. Looks to be a tiny birthmark. 2 millimeters. And seeing a little cyst here that measures 1/2 centimeter all around. Just going to gauge to see how raised it is. It's pretty flush with the skin, but it is slightly raised. I'm going to apply some treatment to that area too, just to cleanse it and so we can keep track. I might take a sample as well. Okay. I have a few more just freckles here, but I just want to measure their size just so we have them for our records. This is exactly 1 millimeter. Okay. And right here, 1 millimeter all around. It's very light. And this one's 1 millimeter too. It's a freckle. I don't think it's a mole. Let's just see. Actually, that is a mole. Has a slight raise to it, so but not to be concerned with at all. Just very tiny. Okay. I'm just gonna see if there's anything here. A slight indentation. And just grab that measurements. Definitely a little birthmark. That's gonna be 2 millimeters. Definitely flesh with the skin and not a mole. Okay. I'm going to just lower your pants just slightly so we can see the belly button. Perfect. Okay. Okay. It's gonna feel slightly tingly. Okay. Make sure that's going in all the way. Yes. Next, I'm just going to be adding some nourishing exfoliation. Applying some drops of water. I'm just gonna gently blot that in. Just continue the cleanse.
Smells nice.
Yeah. It's all natural products, so it does have some aloe in it. I think there may be a little bit of hemp as well. Just adding a little bit more of the solution. Okay. Just going to add one more little bit of the initial foaming solution. Just to make sure it settles in. Hopefully that feels a little bit more soothed by now. I'm going to just finish with some rose water. Just let that soak there. Okay. Nice. I'm going to do just a little bit of tapping therapy on the stomach. That really is going to help with some of the indigestion problems that you've been discussing. I'm going to use some wooden tapping, also using a seashell. It should really help.
Okay.
So next I'm going to be doing some tapping therapy on the stomach, just to maybe help with some of the inflammation. I want to do these types of techniques before I put you on an antacid. I can prescribe you with some things to reduce acid in the stomach, but I think that some of these techniques in combination with a bland diet are really going to help as well. Okay, so it's just going to feel like a tapping. Okay. Actually, I'm going to just moisturize the area a little bit. Warm oil. Just going to be soothing. Okay, I'm on top. So I think we're done for the day. I can go ahead and give you a script for pantoprazole. I don't want you to take it though until you followed up with a week of just seeing what this did, and a bland diet. And I know that's really hard to follow, but it's the first line of treatment against gastritis, upset stomach, nausea, and I know that your symptoms are very comprehensive, but we just want to rule out the simplest things first. Okay? Before we start doing imaging and prescribing you with things that maybe you don't need. Okay? So a week of just a bland diet, that means no spicy foods, no oily or fatty foods, just very bland foods. Rice, eggs, bread, things like that. It's going to be very, very, very boring. So find other ways to spice up your life. Watch a cool TV show. You know, paint, do some things to distract yourself, because I know personally it's almost impossible to follow.
Yeah.
But you can do it, Mata. You can do it.
Thank you.
Okay. And then I'll call you in a week and we'll follow up from there.
Perfect.
Okay? Okay, great.